there any challenges you think that he's going to be facing, or did you leave any pokers in the fire for this?
Yes, there always are challenges in healthcare. Certainly continuing to recruit physicians will be a challenge. The financial picture is always going to be a challenge as we go forward, especially in light of the economic situation, and the government may not be providing all the funding it has promised. And then there's just the ongoing challenges that I mentioned before, like the ALC issue, funding for specific programs, addressing the gaps that exist today, and so on.
Well, let's talk about some of those gaps. What are the gaps as you see them?
Probably one of our biggest gaps is in mental health services. We have to ensure that we're caring for those people. We have to change the approach to mental health services, not having the stigma attached to it that currently exists, and to provide the right services for people.
And that's something that's done at the triage station. It's something that's done at when they first walk in, and that's something that's done by checking the website as well. Obviously, there's so much information available about the services that are provided by Northumberland Hills Health Services. I know I've been there, as I said myself. I suffer from a respiratory disease, unfortunately, so I've been there. Some great services, and I'm just glad to see that people aren't being whisked off to, Peterborough or sent off to other hospitals for basic services. But let's talk about some of the added services that have come through the hospital then. I mean, when it first started off, it was a small community hospital, and when you first came on board, I trust. And so what types of services have we seen expand and grow at the hospital that you would say you're the most proud of?
Well, I'm certainly very proud of our diagnostics. We have added the CAT scan, we have added MRI services and nuclear medicine services. We have a state-of-the-art diagnostic imaging facility there. We have also added inpatient rehabilitation services so that when you've had your hip or knee operation, as soon as you've had the operation, you can come back and have your rehabilitation at our hospital rather than staying away from your loved ones. We've added dialysis, expanded chemotherapy, added various cardiac programs as well on an outpatient basis.
Well, I know the palliative care services that are provided there are top-notch as well.
Yes, and I should have mentioned palliative too. We did do some palliative previously, but it wasn't as a unit, and now we're able to provide an enhanced services by having the patients all in the same area.
And what kind of strain has that put on the overall budget for the hospital that they're adding these services? I mean, obviously, at the beginning of every year, you're allotted a specific, line figure, and then during the year you say, well, let's try and add this service, let's try and add that service. Has that increased the budget like incredibly, or how is it that you're able to stretch those dollars to include those new services?
Well, our budget today is over $54 million. Before we moved, it was less than $25 million. So we more than doubled the budget. And the way we did that was actually in the construction of the new hospital. Part of the negotiation with the ministry was for operating funding. It took a lot of meetings, as I said, it took a lot of time, but we were successful in getting funding for those programs.
Well, I know that out in Quinte West, in their health facility, I know they're struggling, and it's a similar situation to what you had when you first came on board, I guess, was only this is 3 hospitals, or 4 hospitals, I guess, at the Quinte West Health Services Center. So obviously they're going to be tackling issues not unlike the ones. Any suggestions for them, how they can tackle their issues? I mean, obviously, they're very similar to what you would have come on board to. I mean, it's a smaller catch basin, I suppose, here in West Northumberland, but I mean, obviously, it's a huge burden for them. Lou Rinaldi was telling me that a couple of the hospitals are 3 hours away from one another, and they're all under one umbrella. So,
I just say keep working at it. It takes a lot of hard work. Never give up. And Lou Rinaldi has been most helpful to us as well. We've really appreciated his support. He really tries to understand what our issues are and isn't afraid to go to whoever he needs to get solutions.
Well, it is a huge catch basin for the Northumberland Hills Health Center as well, and obviously getting emergency services to people in smaller or rural areas as well. How have you found that challenge?
We certainly do a lot of promotion. We do a lot of PR work so that people understand what services are available at the hospital. They know how to access the ER, how to access the fast track, and what physician services, i.e. walk-in clinics, are available locally as well.
Well, I understand that there's some talk now of building a medical center on site, or maybe even building one of those medical teams, if you will, out of the hospital. Is there any any truth to that?
Oh, there certainly is. There certainly is. We are hoping to have an RFP ready to go out to our short list of vendors, and with the goal of hopefully starting construction next spring. We will need ministry approval to do that, however, so there still is some work to be done there, but that's our goal.
So now, what can you outline some of the advantages of having that type of facility on site as opposed to some distance away?
Often the physicians who are in these family health teams are also supporting the hospital in various services, seeing inpatients, doing emerg work or whatever. It's easier if they can come in from the office, run into the hospital, and then get back. They could be delivering a baby, and of course one never knows the exact moment that happens, so it's much easier if your office is close. We also have a great need for space for our community mental health program and ACT teams. They're located in less than ideal facilities right now, and the space isn't readily available in this community. So we want to build something where they're close to the hospital, because again, those patients might need diagnostic tests, they may need to go to emerge, so the close proximity is ideal there.
Well, and just the comfort level, I guess, of having the hospital right there.
That's right.
Especially if you're dealing with people with mental illness and what have you, then there's obviously, as you said, the facilities that are available right now are less than ideal. So it does make it, somewhat nerve-wracking for someone, especially who's suffering from a mental illness, as to being comfortable going to these types of facilities. So the goal then is to make it more comfortable.
Ensure privacy. That's critical, obviously, when you're counseling any patient. We all want to feel that our information is private and not overheard by others.
Well, it sounds to me like you still got your CEO hat firmly on, so it's going to take a little while for you to shed that, I would think. Now, are you still on call? Have you said to them, look, if you need me, give me a call. I can be there.
Yes, certainly I'll be there anytime they want to call me, ask me for information. I'll still always have Northumberland Hills Hospital in my heart. It doesn't go away because you quit or retire.
Well, how's your family reaction been to the fact that you're going to be around a little more?
Well, of course, my husband, who's been retired for 9 years, is overjoyed that he doesn't have to spend every day alone. My son and daughter-in-law are happy I'll be available to look after the 2 young boys on PD days, when it's often difficult to get somebody to come in.
Do they live in town with you as well?
In Markham.
Okay.
And my daughter and future son-in-law are getting married in July, so of course I'll be busy with wedding plans as well. So there'll be lots to keep me busy.
You've got a full schedule. Now, you were talking before about, before we went on air, that you were talking about traveling in Trent Severn and saying, you weren't exactly prepared with a map of where you were going, and you kind of got lost. Is that how you're going to look at retirement right now? You're just going at it, winging it, as it were, and if a plan's necessary, you'll throw one together. But as it sits right now, you're retired, and you're gonna kick back for a little while.
I don't have any navigation chart right now. First time in my life, I think, that I haven't had the next several years totally planned out. So I just want to see what happens and go with it.
Well, there's always ballroom dancing.
I'd love it if you can convince my husband.
Well, my father-in-law could probably do a better job of that than I could, but no, you know what? It's been a wonderful experience chatting with you, and I mean, the people who are at the hospital, you had a wonderful big dinner to give you a send-off.
Yes.
And some lovely parting gifts and prizes, I would think.
Yes.
Sounds like a game show. Retirement almost sounds like a game show,
It was a wonderful time, and I really appreciate the opportunity to have worked here. I think anyone who sits in that job can consider themselves lucky.
Well, on behalf of the citizens of Northumberland, Quinte West, and I want to thank you for the job that you have done. I know that I've used the services several times since I've been here in 6 years. And I know my son has, and the people I know, and I know friends who work there at this hospital, and nothing but praise for the work that you do. You're a people person, Joan. That's what I hear, and so we're very happy that you enjoy retirement, and I want to thank you for coming on the show. And I want to remind the viewers that this is Municipal Matters.